Emerging healthcare leaders think strategically about every area of healthcare, from complex case management to making care more affordable. Increasingly, however, physicians are being tasked with such leadership roles. Fortunately, AHA can offer some new leadership development tools for clinicians that help them assume these important responsibilities. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly, senior writer for the AHA, and your host. We have three experts on hand today to talk through the steps of identifying leaders, helping them succeed, and transforming your organization along the way. Elisa Arespacochaga, Vice President of the AHA Physician Alliance, is joined by Dr. Bhatt, AHA Senior Vice President and Chief Medical Officer, and Dr. Brian Juncker, Partner at Strategic Talent Solutions. Let's pull up a seat at their table.
Good morning and welcome to another in AHA's ongoing series of podcasts where we focus on important issues facing clinician leaders. I'm Elisa Arespacochaga, Vice President of AHA's Physician Alliance, and today we're talking about emerging physician leaders and how hospitals and health systems can foster the skills needed to succeed. The Alliance, in partnership with Strategic Talent Solutions, is offering a 360 leadership feedback program to assist in identifying and developing the skills and attributes needed for today's dynamic leadership roles in healthcare. Targeted specifically to emerging physician leaders, this program arms them with the information they need to chart a development course for the next phase of their careers. Today, I'm really pleased to have joining me Dr. Brian Juncker, partner at STS, and Dr. Bhatt, AHA's Chief Medical Officer and Senior Vice President. Welcome, and thanks for talking with me. To get us started, I'm going to ask you each to tell me a little bit about yourself and your organization. Brian, we'll start with you.
Sure. As you noted, I'm a partner with STS, and I'm a clinical psychologist by background, having worked quite a bit in academic medicine, having served on clinical faculty at places like UW Hospital and clinics, which is where I really got steeped in basically just the world, the culture, the dynamics, the needs within the healthcare industry just generally. Of course, I joined STS about 10 years ago. We work really across a range of industries, but we do have a particular specialty in healthcare generally and academic medicine specifically. So I do a lot of work with physician leaders, really kind of at all points of their kind of career progression, both on their leadership effectiveness as they engage their teams, their functions, but also as members of leadership teams, they kind of guide hospitals or systems.
Great, thank you. And Jay?
Sure. Bhatt, Chief Medical Officer, has noted, and I'm an internist and geriatrician working in both community, clinic, and hospital settings. And one of the areas that we work on is connecting administrative leaders and clinical leaders around common language and approach to shared decision-making. So we know that there's an evolving environment in terms of how we think about doing the work of caring together as a healthcare workforce. The issue of leadership and management becomes critical. And so the AHA Physician Alliance has really been lifted up as an environment in which we could advance this common language for leadership and shared decision making. And I think physician leadership development is part of that work.
Thank you. Now, as I understand it, this idea for a physician leader 360 really started as a conversation between the two of you. Can you talk a little bit about how you identified this as a need and how you started developing the idea?
Sure. We continue to see a problem related to leadership development among physicians that wasn't going away, and it required a new solution. Because of an environment that was changing so rapidly, the knowledge, skills, and behaviors the physician leader required for success was changing too. And I think that we, and certainly from personal experience as physicians, have been trained in a particular construct. And that doesn't always serve us well in the context of leadership and management, and particularly so in this time of change where we're being asked to think about new teaming models, new care pathways, and ways of working across the continuum that may challenge the very training in some ways that we've gotten. And so with that, I asked Brian, a colleague and friend who's had some experience in leadership development and engaging with the healthcare workforce, to have a conversation we started to talk about this problem. And I asked Brian, what he had seen, what experiences he was having. I didn't feel like I wanted to be out in outer space and say, am I the only person thinking that this is an issue? And so that began a conversation. We began to write some key themes on a napkin at this coffee shop where the table probably wasn't even large enough to hold both the napkins and the coffee. And we were so excited about sketching this out that we wanted to start right away. And out of that napkin was born an idea about how we might try to think about this problem differently and address it. That led us to this physician leadership assessment tool and approach that I think can make a real difference for developing the physician leaders of today and tomorrow. Brian, is that how you saw it?
Very much so. And I think one of the neat things about this whole journey with y'all has been that, when you came to the table that day, you were coming with the more of that kind of AHA perspective and having been talking to members kind of more high level about kind of what they believe their needs were. And our perspective is we typically come at it from kind of, where people typically engage us when there's some kind of pain point, some kind of transition point within the business, within their organization. And they basically say help. We need help, figuring out how to get through this because we're stuck. And what we were finding is that when various kind of health organizations would engage us either for leadership team support or individual kind of leadership effectiveness type support, these were the common themes that were coming up. Just as you noted, a lot of change going on in the healthcare industry. And at the time, this is, effort's been a couple of years in the making. And at the time, this was really just starting to get steam. People were really starting to accept that this was not only, the near term, but also this is going to be what healthcare is going to be all about for the foreseeable future. And really kind of a lot of integration, a lot of consolidation, a lot of need to be that true organizational leader that has to learn how to get people and parts of an organization to work together to deliver the best patient care. And, Jay, as you noted, not necessarily how physician leaders were trained. And so it was just creating a lot of, I guess we'll just kind of call it tension associated with people trying to show up, do their darndest every day to be the most effective leaders and really struggling with it. And so we were seeing that from the work of members or when physician leaders would approach us for support, and y'all were seeing that from your side when members would kind of talk about what the needs were. Then, of course, you and I show up at that coffee shop, sit at the table and say, let's go discover things and change the world. We can get excited about our ideas and then get really disappointed and let down when we later realize that perhaps they weren't as valid or there wasn't as much to them as there was. So what was particularly neat was where we took this idea and then we basically, through, Jay, quite a number of connections you had, some of our connections as well, we sat down with these chief medical officers from, basically big metropolitan systems to kind of rural community hospitals and interviewed them. And we did these structured interviews and then did these, qualitative analysis to get at what they are seeing as today's and, tomorrow's kind of the real challenges, the real needs for physician leaders. And it was quite cool to kind of step back from our rigorous scientific process, we've been validated, this idea has legs.
Brian, that was interesting because it resonates in the fact that when I was talking to senior physician leaders in the field, they were articulating the fact that we're not even sure, how we might identify physician leaders. We'll give them some responsibility and see how that goes and then decide to further invest in their development or see a need with a particular group of physicians. But I think I felt like our initial perspective on what might be needed related to this kind of leadership development resource or tool was altered by the conversations with some of these physician leaders. And these were experienced system leaders with firsthand and frontline knowledge of physician leadership development realities. And they identified some of the criteria to consider were systemness, sort of this sense of having a system-minded approach, strategic thinking, one that has not only strong clinical competence, but also shows up well in teams and engages with others, but also is constantly sort of thinking about improvement and using reliable, systematic approaches to the work. But I think that those conversations helped us also together, as we had them, validate that there really could be something here and that it required even more, I think, conversation with the field about what that might look like and what might be useful.
Jay, I think it's a great point. There wasn't a common framework that we heard from these various, CMOs about what constitutes a good, effective physician leader in today's environment. Everyone kind of had their own way of kind of expressing this, but everyone was kind of making it up based on their experience as opposed to, kind of drawing on a common or shared understanding, which was pretty cool. And to your point, like that just being that systems thinker that can manage all that complexity, that can be very, kind of outcome focused versus process focused, really kind of rely on the data as opposed to, what is the data actually telling you is going on versus what you think is going on. And then all that, what often gets termed soft skills, but that that integral ability to actually like manage various stakeholders, kind of build consensus, develop a strong team and kind of lead through that team, identify and manage conflict so that you can get people working together and get things done. I mean, all that stuff started popping. And one of the things that I thought was probably one of my favorite anecdotes or just kind of aspects of those interviews was, first of all, how excited all those chief medical officers were that we were even doing this. It's sort of the, thank you for even asking the question and being willing to like wade into it and try to answer it because we need this, A. But B, the other thing I loved about what they said was like, when we said, hey, what kind of advice or counsel would you provide to kind of, emerging, up and coming physician leaders? And the most common theme was like, whatever you do, don't do it like I did it. And of course, that common story was no framework, no development, no training, just throw yourself into these leadership and organizational challenges, sometimes messes, and like have to bumble around and figure it out.
Wonderful. Great overview of both your vision and some of the key attributes that you've come up with. Jay, I'm curious what you're hoping hospitals and physician leaders will really take away from going through this experience, and then I'll ask Brian the same.
I think that one of the opportunities here is to build relationships and strengthen common humanity. I think we can't advance the work of leadership development without beginning from a common language and framework. And so hoping that hospitals and health system leaders have a framework and approach to help them with addressing physician leadership development. And we know that some of the skill gaps that we're seeing is what Brian mentioned earlier and what I had said around system-mindedness, strategic thinking, interpersonal skills, negotiation and persuasion, and conflict resolution, as well as business and finance. And so, there is the leadership piece of this, and there's the management piece of it, and the operations piece. And so, hoping that this makes it easier to do what physicians and their administrative partners want to happen is to come together so that they could reimagine a better care delivery system for their patients, families, and communities, and that also could create strong culture and interpersonal relationships to have exceptional teams delivering that care. And so this is also a tool that will be, a way to start conversation. It's always easier to have data and a framework to begin a conversation and react to than a blank sheet sometimes. And that is what we hope this resource and tool will allow our members to do. And that it'll be an iterative process, and that we'll learn as a community and as a field about what some of the emerging opportunities are for growth among physician leaders and what resources and tools and education that we might need to further help the field with. And I think that this will give hospitals and health system leaders and clinicians further confidence in their leadership and management capabilities.
Thanks. Brian, what are you hoping that leaders will take away from this process?
The answer to the question is probably like it's overly simple. But, what we kind of hope that physician leaders take away is like an understanding of like how they need to lead differently and really the tools and resources they need to deliver against that, to actually lead differently. We're a very practical and pragmatic firm like STS is. And while we believe so much about like behavior change, like very much starts with like insight. It's both insight about kind of where the organization is going and what the organization may need from you as a leader or, from leaders generally. And then insight into like how effectively you are not leading, and, in support of, those strategic objectives and support of the goals that the organization may have for you, generally or specifically. Well, the organization should have for you, both generally and specifically. So that insight is really important, and you really got that perspective in terms of like what you're there to deliver. At STS, what we want to do is really clarify both aspects of that, like what you got to get done for the organization and kind of what you're bringing to the table as a leader and what you need to work on. And so we want people to really kind of really see what they're there to do, how they need to go about doing it, and then really kind of be armed with, the tools and resources they need to be effective doing it. Because what we know and what we're seeing is that so many physician leaders are being asked to think and lead and behave differently and in a way in which they may not have even seen before from their senior leaders, their mentors, and more often than not in ways in which they most certainly have not been trained to kind of, lead, think, and behave. And so we absolutely want to make sure that they really have the tools, the guidance needed to be able to actually go and lead differently and be the effective leader they need to be as the system needs them to be.
So, Brian, you and I had a chance to pilot this with a couple of systems. What were your key takeaways from the early users of this program that you really were surprising to you, maybe?
With regard to the kind of the surprises, the insights we got from the physicians leaders who participated in these pilots across these member hospitals and systems was truthfully the framework. It was an understanding of the common language. It was a shared language. This idea of like, oh, you're putting words to what I struggle with every day. You're putting words to like what I've not been understanding sort of my job and my responsibilities are. You're making it possible for me to talk about this more clearly and coherently and think about it more clearly and coherently and truthfully go get more support and help as I may need it. We spend so much time in this world thinking about this stuff. We live in this stuff. And to have folks say just the utter simplicity of like, thanks for basically simplifying chaos for me so that I can understand what my job is.
That's a really good point. I think one of the pieces that I most took away was the impact that an organization going to their clinician leaders, especially their emerging physician leaders, and bringing them into a program like this, the amount that meant to those physician leaders to say, oh, my organization cares about me and wants to help me develop along the lines of what you were saying, is they want me to know what this position is and what this work is even better. And that helped cement their connection to their organization in a way that I don't think some of the other activities had been able to. So that was a little bit of a surprise for me, how much this program helped foster that relationship between the administrative team and the emerging physician leaders as they work together.
That's a really good point. I think we knew this, but I think one of the simple ahas, and Elisa, I think part of this came out when you would give a little bit of the picture of kind of you'd paint the story about what's transpiring across the industry in terms of the transformation that's going on really across the field. You'd highlight that, really, administration is being pushed together with physician leaders for the first time, having really kind of power share and kind of work together to kind of lead the organization. I think some of the emerging leaders hadn't been faced with that yet, hadn't seen that yet. And so I think one of the neat things, and we knew this going in, was that we were going to be teaching people about what some of the tensions are that they're currently facing and giving them the kind of the understanding of kind of what their strengths and development areas may be pertaining to those current challenges. But we're also helping them see that, like, you may not even know this is part of your job yet because it isn't as salient as it's going to be if you stick with it. But, if you take on any more responsibility or you spend another year in this role, you're really going to start to see that, like, you're going to need to be able to, like, have that vision, be that conduit to be able to see how the various parts of the organization are working together or not, and then be able to kind of wade into it and actually, get these parts of the organization, parts of the hospital, talking with one another, working together, and sewing that fabric together so you can have, and Jay, you mentioned this, basically really like quality care across the full continuum and how that's going to be an utterly critical part of your success as a leader. So that was also one thing that was I think we had some conversation, if I remember correctly, where some of the physician leaders, they wouldn't necessarily like say really as if like we blew their minds, but a little bit more of, I don't necessarily know that I saw that as being a big part of my responsibilities, but now that you mention it, I can see it.
Jay, how would you describe really the value you see in this work to hospitals and then to those emerging physician leaders?
I would say that the Physician 360 has incredible value for hospitals and health systems. One, it gives them opportunities to practice and coaching to physician leaders. It's also a way that physician leaders can learn from what they're doing in their firsthand experience, but also their teams and their managers can learn that as well to help provide advice, perspective on development, but can help the physician leader identify gaps that then can be linked to offerings that either STS or AHA may have to help support them in the journey ahead. Two, I think it helps provide not just one perspective or a quantitative approach that seems like it doesn't have a number of different perspectives, because I think that the 360 allows multiple views so that things might not be necessarily missed, or you have various perspectives to draw from in establishing your development journey. And I think that people see and hear approaches of leadership in different ways. And so I think that that's helpful. Three, I think it gives hospitals a framework and approach to identify where they need to develop physician leaders, where they would invest their time, resources, and energy, but also gives them a pathway for learning about their own approaches as an organization to leadership and management training. And I think that this involves formal and planned education, informal education through mentorship, and structured feedback and coaching. So they may find that particular approaches to mentorship or coaching aren't working the best, or that there are responsibilities that a physician leader may have that might not best fit their strengths. So I think that this is sort of actionable intelligence to help reimagine healthcare for their organization, as well as deliver the care to patients, families, and their communities that they can be proud of. And I think for physician leaders, it's some of the same. It's certainly opportunities to learn and develop in a structured pathway and roadmap. It also provides them with the opportunity to establish a relationship and have dialogue and get feedback from a number of different people. And it might not be the same people that they go to for feedback. And so this allows the differing perspectives to provide a holistic view of both the strengths and the development opportunities. And it gives physician leaders an opportunity to feel like their organization is invested in them. We know that when organizations are invested in physicians and care for them, they care back. And so it allows also opportunities that are so critical for physician leaders to enhance their ability to contribute to leadership and management as it comes to reimagining the future for the organization.
Thank you. Brian, how would you describe the value of this 360 to both the systems and then specifically those leaders you get to work with?
It's understanding what the job is, understanding kind of what you need to do differently to be most effective in your job, and understanding how you need to be pushing yourself as a leader to be even more effective, just to maintain your effectiveness as you increase the scope of your responsibilities.
So Brian, I think what you made reference to in terms of understanding how the job is different relies on also understanding how the team views the job being different, because there's a job to be done that may be individual, but you're in the construct of a team. And as we move to this sort of team-oriented approach that's so important in the changing delivery system, I think it also gives insight into what might be the capabilities of a team and how do you pull that together, and then how do you push development in a way that it helps support organizational agility and managing key stakeholders and comfort with uncertainty. I think that those are things that typically physicians are trained in a sense, but there's a algorithm or an approach or also some critical thinking, but you can draw on established evidence to support that.
Jay, it was a really good point you made about, really the idea of kind of leading through teams. And this is something that, there's stereotypes, of course, about, physicians being, tough, kind of quick to speak their minds, authoritative in terms of interactions, all those kind of like common stereotypes. When you get down to it, you actually step into practice, more often than not, it's the opposite. And when it comes to being able to lead a team, it's the whole idea of like, you can't be everywhere. And so you have to have really qualified, really sharp people who have really high standards, who you can trust to actually go out and, deliver to the top of their licenses, like, under your authority or your supervision. And you've got to be able to oversee that. And part of the overseeing that is setting high standards and giving people tough feedback if they fall short of those standards. And that coaching, the performance management, that kind of people aspect of team leadership it's hard. It's difficult. It's challenging. It presses a lot of physician leaders and poses some real challenges. That's an instrumental piece of that, that effective team leadership piece, and it's holding people accountable in a way that's constructive. That we do see a lot of need.
This assessment, the advantage is that it's brief and effective method for assessing the leadership skills and behaviors, and it could be incorporated as part of a suite of tools that an organization may already have. So I think it allows for compatibility and complementary approaches to leadership development. Brian, would you agree?
I would agree. At the end of the day, we want to meet members where they are in terms of whatever skills or resources they may have already kind of baked into their organizations, such that, yes, we may be able to provide kind of a nice assessment tool that helps kind of provide the framework, what good, effective physician leadership looks like, and then give each of those individual leaders feedback to where they know where they have strengths and development areas and what they need to work on to be, of course, a more effective leader. In terms of the resources you may tack on the back end, because at that point in time, you provided insight. But of course, we've all set, our standard here is that insight isn't enough. We want to actually help move people to behavior change so they can actually demonstrate the right behaviors. That's where you may be able to partner with member organizations to kind of make a handoff to whatever the resources they may have in their organization, where they can actually take and then now run with the development from there. Or we will be able to provide resources as well to help coach, develop those physician leaders either individually or perhaps as a cohort to help figure out how to take those insights into practice, into behavior change.
Thank you, guys. I think this is awesome. I really appreciate both of you joining me today and sharing the genesis and further development of the Physician 360, a great tool and resource for the field.